Welcome to Cambridge Health Alliance Health as Well. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we have Vonessa Costa with us. And she is Manager of
Multicultural Affairs and Patient Services.
Multicultural Affairs and Patient Services. Which means that Vonessa has interpreter services. And since we live in our area in Cambridge, for the Cambridge Health Alliance, is comprised of so many different cultures. We're a melting pot here. So many different cultures and languages. We serve those people, and we have a lot of staff that are of other cultures and speak other languages, but in the event that we don't, we have interpreter services. So, how many languages do we have on it? Oh, so welcome to the show.
Thank you very much. It's a pleasure to be here.
Yeah, thanks so much for coming. So, how many languages can we provide to people?
So through our partnerships and through our contracts, we can provide more than 150 languages, but we've never used them all in 1 year.
Oh.
So in a typical year, we serve about 62 different language groups.
Wow.
And last year was a record year in terms of interpreter requests. We provided over 255,000 interpreted encounters throughout the year.
255,000?
255,000 in 62 different languages.
Wow.
It really is a diverse community.
I would say Mamma Mia.
Currently at CHA, 42% of our primary care patients speak a language other than English at home. And that's true of our staff as well. 40% of our staff actually live within our service area of Cambridge, Somerville, and what we call IMCREW, Malden, Chelsea, Revere, Everett, and Winthrop.
Yeah.
And so we like to say that we're an organization for the community, from the community. Many of our staff are also patients, and a lot of patients tell us they feel comfortable walking in and seeing people on the front lines that they know,
right.
Seeing relatives, neighbors, others, and also seeing people they can identify with and communicate with.
Exactly.
Very
communication is an important thing, and if they're coming into the Alliance, they might be coming in for a checkup, but they might also be coming in because they're not feeling very well. And I cannot imagine being sick and then, for the population that I serve is the elder population, to being sick, to being old, and not being able to communicate.
Absolutely.
I can't even imagine it. How frightening it must be.
Yes.
That you cannot get your thoughts and your feelings and even your symptoms or whatever across to someone. Mm-hmm. I know how hard it is English to English sometimes,
yes.
Right? That we have trouble communicating. It's the worst thing we do on this earth plane, by the way. We don't know how to talk to each other, really. So now, the interpreters that we have a staff of interpreters.
We do.
Yes?
We do. We have in-house interpreters, staff and per diem, and we also have partners and vendors.
Per diem is on a daily basis as we need them, right?
As we need them.
Yeah.
So, for example, we have full-time staff in a variety of languages, Portuguese, Spanish, Haitian Creole, French, Hindi, Bengali, and Arabic are languages that we staff on a daily basis. But we also have other languages that we staff. We bring in per diems as needed for scheduled appointments, and a variety of languages, anything from Greek to Albanian to Mandarin.
Yes, I've used Mandarin. And the other thing I've used, just recently this year, in all my years here, it was hard of hearing, the American Sign Language.
Yes, we are so proud to have 2 American Sign Language interpreters on staff now.
Yeah.
And they serve a primary care group of about 39 individual patients. But there are many other patients who come to CHA for special services that also utilize the American Sign Language service.
Right. So, of course, that's only as good as if the people have learned it themselves. Right?
Absolutely.
Otherwise, hopefully they read lips. Or how well, or we write things.
Right. So for patients who are fluent in American Sign Language, they are signers, then we can provide the interpreter services. There are patients who have lost their hearing over time and haven't learned American Sign Language.
Right.
And we can also provide a variety of services for them.
Oh.
For example, we can provide CART service, which is a CART, Computer Assisted Real-Time Transcription. And so what that is a cart operator will come with a little computer to your primary care appointment and will type out what the provider is saying, and you can read it on screen in real time. And this has been helpful.
Kind of like closed caption.
Very much like live closed captioning in the room.
Wow.
And it's helpful for someone who has lost their hearing but never learned American Sign Language.
Right, wow. So we have many different ways.
Many different ways of communicating.
Wow. So tell us what it takes to become an interpreter. I know often families will say to me, well, I can do it. I'm the son, I'm the daughter, I can interpret for my parents. And that is good only as it is superfluous communication, really,
Yes.
right?
Absolutely.
But not as far as medical.
So every interpreter is bilingual, but not every bilingual person is an interpreter yet, because medical interpreting is a profession. And like with any profession, you go to school and you learn it. So the U.S. Department of Health and Human Services has established standards for medical interpreters. And one of the standards says that interpreters, or whoever is responsible for providing language assistance in the healthcare organization, has to be someone who has demonstrated competencies. And the competencies they need to demonstrate include fluency in both languages.
So that would be a test. Is that like a
It
test?
could be demonstrated through a test or through a portfolio.
Oh.
Personally, I prefer testing to really ensure that the person is fluent in both languages and that they have the medical terminology as well in both languages. In addition, the Department of Health and Human Services specifies that that person should have some knowledge of interpreter ethics.
Oh.
And one of our ethical principles is impartiality. And this is something that's impossible really for family members, because how can you be neutral or impartial about the outcome of the care of someone you love?
Exactly.
So where there are feelings involved, it's very hard not to put your own 2 cents in, which is something a professional interpreter could never do.
Right.
So there are many things that happen when friends and family are used as interpreters. I want to start by saying that at CHA we are a family-friendly organization, and we recognize the important role that family members have as caregivers or as support system, emotionally, materially, physically. Sometimes they are the transportation to the appointment, and there are many situations where patients want their family members involved in the conversation, and we accommodate that at CHA. However, when it comes to the family member being designated to interpret, family members typically aren't familiar with the medical terminology, and they often make mistakes, leaving something out that could be clinically significant, or consciously or subconsciously redirecting the conversation because they have an agenda. Out of good intentions, they have some idea of what they want the doctor to prescribe or how they want the conversation to go. And what providers tell us is that they sometimes wonder whose voice they're really hearing. Is it the patient's voice, who's limited English proficient, or is it the voice of the family member who accompanied them to the appointment?
Right.
So we want to make sure that patients have a voice in their care, that they have
Absolutely.
the ability to participate as actively as they desire. But we also
Are able to.
Yes, absolutely. But we also want to minimize the stress on family members because that role, it's stressful enough, and it's a huge responsibility in itself. Without that added worry of, did I interpret correctly? Did I use the right terminology? Did I miss something because I couldn't retain all of the information? And does my family member truly understand what the provider is conveying, and vice versa?
It kind of are you making me think of maybe like Google Translate? You know, you can translate the words, but the concept doesn't always get across.
Absolutely.
Right. So with the medical interpreters, it may be and the families could translate the words, but if they don't understand the medical concept, then they can't get the concept across.
Yes.
Similar to that.
Absolutely.
Yeah.
Also, there's no umbrella of liability. There's no protection really for the patient, for the provider, or for the organization should the family member make a mistake. There was a case out of Florida, very famous, where because of one word, and the word was intoxicado in Spanish, that a family member used to describe the symptoms of her loved one who was a patient. And the providers understood that to mean intoxicated. But what she was trying to say was that he appeared to be suffering from some kind of poisoning.
Oh.
But anyway, because of that one word, decisions were made. And it ended up that the patient, when he woke up from being unconscious, he woke up a paraplegic and he had not been before.
Oh my.
And the family sued the hospital and won a $71 million judgment. And ultimately, it came down to a misinterpretation and a misunderstanding of one word. So language access and communication in healthcare has clinical implications. And we want to keep our patients safe as well as we can.
Right.
So in a situation where patients come with family members and they want their family members to participate, they will be invited to participate. We pull up an extra chair in the exam room, but we want to make sure that the person responsible for the communication across languages has demonstrated the competencies and is going to keep the patient safe.
And that's true of the family as well.
Absolutely.
We want them to understand, to get the right concept and understand it the way we're meaning it.
Yes, yes.
Right.
And of course, there's always sensitive situations where patients may not feel comfortable talking to providers about things like sexual activity or domestic violence when the family member is being used as an interpreter. And so we find that patients often open up more when the interpreter is not someone with whom they have a personal connection.
Exactly. You can tell them anything because there's no judgment, there's no implication, there's no sides to be taken.
Yes.
There's
and where confidentiality is guaranteed as well.
Exactly, exactly. So, is there a program that people have to go through with these competencies?
Absolutely. So there are community-based programs and college-based programs that can prepare you for a career in medical interpreting.
Okay.
The community-based programs are offered locally and they can run as short as 3 or 4 months of intense training. Some of the college-based programs are also local, and for example, Boston University has a 1.5-year long program. Cambridge College until recently had a 14-month program. So there are different options that can prepare you for a career in medical interpreting.
So if they came out of those colleges with this degree or this certification,
a certificate,
right?
Yes.
Then we would accept that. Would
we would still test them. To make sure they can demonstrate the competencies.
Okay.
And so it's a combination of training and testing that qualifies someone to be a medical interpreter today.
Okay.
There's
So
also
it's quite a complicated process. I mean, there's a lot to it.
There's a lot to it. Yeah, it's a profession, and it involves a lot of effort to take the courses, to successfully complete them, and then to pass the testing. There's also a national certification process that's available in 6 or 7 languages. For example, there's national certification available in Spanish, in American Sign Language, in Arabic, in Mandarin, in Cantonese, a few of the most requested languages nationwide. And an interpreter can become certified, although it's not required by law. You don't have to be a nationally certified interpreter to be a qualified interpreter.
So, but they would go ahead and do that if they wanted to do, if they just wanted the other accreditation, or
Absolutely.
if they wanted
It's the highest possible credential right now in medical interpreting. And so if it's available in your language, go for it.
Yeah.
It may make a difference in your pay rate. It may open,
that's an important piece.
It may open doors to more opportunities. And also it's a wonderful way to test yourself and to make sure that you have everything you need to be the best interpreter you can be. There's something to be said for attaining the highest possible credential in your field.
So do the telephone interpreters come under you as well? That, we can. I'm not that keen on them because I have a hearing deficit.
Yes.
So the phone is cumbersome for me in any language. But to try to get some. Understand what they're saying and back and forth is difficult. And of course, since I serve the elder population, I'm not the only one with the hearing deficit, right? I have people out here as well who have the same issues. So, but it's available in a pinch, I guess. Or tell me how that's used.
So we have 3 modalities available for interpreting. We have face-to-face, video interpreting, and phone. And the reason we have 3 modalities is because we want to make sure that interpreting is available on demand everywhere in Cambridge Health Alliance.
Okay.
So that if you need it for a clinical conversation or a non-clinical conversation, it will be easily accessible in a timely manner. And so you can access interpreter services from any phone in the Alliance. by dialing one number.
Right.
You can access video interpreter services through an iPad-based system.
So that is like, if you know FaceTime or Skype, which I think we're even beyond Skype now, but it would be on a screen.
Yes.
And you would see them, which is,
Absolutely.
I think, easier if you have a hearing deficit, especially, and you're not proficient in American Sign, then you can at least read their lips and make out what they're saying, or make sense of what they're saying.
So
sometimes.
video interpreting is beneficial for the interpreter and also for the patient. A lot of patients like to see who's doing their interpretation. They like to put a face to the voice. A lot of interpreters like to see what's happening in the exam room. For example, if it's a teaching or a demonstration, for example, a diabetic teaching, it helps the interpreter to see what's being demonstrated. It makes it easier to recreate that message in the other language.
Well, that makes sense.
Yeah.
That makes sense.
And we also have in-person interpreters at our hospital campuses and at a few of our larger health centers for the major languages represented. So if you think about what are the major languages of Cambridge Health Alliance, within our patient population for primary care, we have almost 17,000 Portuguese-speaking patients.
17,000.
17,000.
Wow.
We have about 12,000 Spanish speakers and just under 7,000 Haitian patients.
Really? I would have thought it would be more than that.
We are unique as an organization in that Portuguese is our most requested language, followed by Spanish, followed by Haitian Creole. Also recently, two other languages are growing quickly. One is Arabic and the other Nepali, and we have about 1,500 individual patients for each of those languages. So we consider those to be the major languages of Cambridge Health Alliance, and we strive to provide in-person interpretation for the major languages at our main hospital campuses on demand.
So can I ask you a question? So when I call, because often I'll call to book an interpreter to meet me to translate a presentation that I'm doing. And am I scheduling one of our inpatient in hospital interpreters? Is that what I'm doing? Where does the pool come from that I use?
Sure. So if you are coming to one of our hospital campuses, Cambridge, Somerville, or Everett, most likely the interpreter that comes to you in person is someone that's based there every day on the regular staff.
Okay.
However, if it's for a language that we don't staff every day, you can call in advance and book, for example, a Greek interpreter or an Armenian interpreter or a Somali interpreter, and we'll do our best to prearrange that service. That interpreter could be an employee of the hospital working per diem on an as-needed basis, or they could belong to a partner or a vendor of the hospital, an agency interpreter.
I always try to book in advance anyway, just to ensure, and I'm still waiting on one for the 29th, and that's a Mandarin interpreter, because I find that the buildings that I go to, there are pockets, large pockets of Chinese folks, and they split. They're split Cantonese and Mandarin. So I'm told there is one dialect that they can all read. Do you know which one it is?
So there are two forms of written Chinese. There's the traditional and the simplified. Simplified Chinese is more used in mainland China, but there are some exceptions. We provide written translation services in both. So you really do need to identify which population you're going to be speaking to in terms of their dialect, and then we can match them also with the written form of Chinese that makes most sense to them. It may be simplified.
Now that's interesting because I did get some things translated, and I'm not sure which dialect they're in now. So we might have to revisit that.
We can revisit that together. But that's the beautiful thing about the service, is that it's primarily hospital-based, but it's accessible anywhere in Cambridge Health Alliance. And we do send our interpreters out into the community. So we send them out for presentations.
Right.
We send them out for home visits with the Elder Service Plan. We send them out to smaller health centers on a scheduled basis. We can send them anywhere where we have patients.
Right.
We want to make our services accessible to the community to keep our patients healthy.
You know, the more shows I do, and I'm in 4.5 years doing the show, but I find out there are so many different ways. At Cambridge Health Alliance, although it might be a small community hospital, we really accomplished quite a bit here. And I'm always amazed, and I get amazed here on the show, because I find out all these new things. and so the other thing I find out, and I see over and over again, which is in total alignment with who I am, is that we really care about our patients.
We really do.
We really care
We're
about our
invested
patients.
in our communities. We care for our patients.
We
Yes.
are.
Yeah.
I guess that's why it's kept us here for as long as we're here, right?
So I have a story for you about how our department got started. It was in 1978.
Okay.
And it was a social worker at what was Cambridge City Hospital who realized that we have Portuguese speakers and Spanish speakers. Those were the two large groups in the community, in our patient population at the time. But that we didn't have interpreters, and that we were using Spanish-speaking bilingual staff to interpret for Portuguese patients and vice versa, and it was very confusing. And she went to City Hall with 2 dictionaries in hand, one Spanish and one Portuguese, to prove to the City Council that these are different languages and therefore we should be providing different services. And that was before there was any legislation that required interpreter services to be offered to patients who speak other languages. But why did she do it? She did it because she cared as a social worker, but also because she was reflecting the values of the organization. CHA has always been an organization that is invested in protecting the community, keeping the community safe, and transforming our services into what is useful, what is meaningful to individual patients in the community.
And so since we were under the umbrella of the city, we had to go to the city to
At that time,
get that going.
in 1978. And since then it's grown to be one of the largest and most robust hospital-based interpreter services in Massachusetts.
In Massachusetts?
In Massachusetts, yes.
In Massachusetts?
Yes.
Wow. I'm impressed.
It's quite a story, where we've come from 1978 to 2016 with 255,000 interpreted encounters.
That blows my mind.
It really does. But I think our heart has always been in the right place, and it's put us a little bit ahead of other hospitals in building the service. And they say if you build it, they will come, and patients do come to CHA for many reasons, because we have wonderful physicians,
Right.
And physician assistants and nurse practitioners. We provide excellent clinical services, but we also guarantee that communication is available in any language.
Right. And so they come not just from our service area.
They come from all over. And there are many patients who originally lived in Somerville or Cambridge and have bought homes in the Metro North area, or even as far away as New Hampshire or Hyannis, and they still come to CHA for their primary care appointments. They're not willing to part with the organization because their experience has been that good, and because other places don't have as robust an interpreter service as we do.
Well, that speaks volumes.
It really does.
Because from the New Hampshire and the Hyannis, that's an hour and a half away.
And they're willing to come.
And they're willing to come here for it. So now what happens, what would happen if they were hospitalized in the cities that they live in? Would our interpreter services connect at all with them if they needed that, or
So
how does that work?
Today, Massachusetts as a state has a wonderful system. We have state legislation on the books that requires all hospitals that have emergency medical or mental health services to also provide interpreter services free of charge. And so patients can access interpreters at any hospital in Massachusetts, but maybe not through all 3 modalities, and maybe not as easily as they do at Cambridge Health Alliance, depending on the language. And so if they were hospitalized in Hyannis, the hospitals there would provide them with language services as well. It would be a different set of interpreters, but many patients would prefer to keep their care at CHA because they've had a very positive experience with our department and with the organization as a whole.
Right. Well, I was just thinking in an emergency, if they were hospitalized in an emergency in their city.
Massachusetts, among other states, is at the forefront of language access, and most hospitals in Massachusetts.
Among other things.
Yes, many things.
Among other things.
But hospitals in Massachusetts tend to be highly regarded for their language assistance services.
Wow. So, it's quite a lot. It's quite a lot. We do a good job here.
We do.
We do a good job here. So what else is involved? For these populations that we have, that we're talking about, you know, the other Portuguese, Spanish, and all of them, actually, are there any major concerns that they're having these days that might affect them in any way that, you know, they're concerned about?
Well, we hear many things from our patients. We hear that some patients are afraid of experiencing some form of racial prejudice in healthcare and in the community. Others are afraid of losing their eligibility for health insurance or other forms of services. Some are afraid about changes to immigration laws and what might happen to someone they love. Sometimes within the same community or even within the same family, there can be a mix of immigration status, for example, with documented and undocumented individuals living and working together. And so it's natural to care about people that you love. There's a lot of uncertainty now. And of course, we don't know what tomorrow will bring.
It's true. We do not know that.
But what we can say is that as an organization, we continue to be mission oriented, and our mission is to serve the underserved. And our mission is to keep our communities and our neighbors healthy. And that's something we're committed to doing. That hasn't changed.
Yeah.
So
that's
in that,
great.
I
There's a
draw
lot of
some comfort.
in that.
Yes,
right?
yes.
And I do know that from what we've heard, Massachusetts was willing to step up to provide for the folks as well. So, we'll see. It'll be revealed.
Absolutely.
We can speculate from now until the cows come home. But the fact of the matter is, we have to wait until things roll out to see what we'll do then, right?
And in the meantime, we're focused on patients.
That's it.
And we're focused
That's
on
who
our
we serve.
community. Absolutely, day in and day out.
Day in and day out. And in a lot of different ways. I do it in outreach, I do it in education, I do it in health-related topics. And so there's that type of outreach to the community, as well as, of course, the actual clinical that happens with the Cambridge. After all, we are a hospital organization.
Yes.
Right? But in all areas, the main focus, I think, is to work preventatively and proactively. So instead of waiting for something to break, we want to keep our people in the loop. Maybe it doesn't break.
Absolutely.
I mean, we can't be successful in all of that, but we can certainly try. When our patients get older and they get more frail, then of course it increases the chance of conditions. But we try. We try to keep them as healthy as possible and keep them informed, both through interpreter services and with respect to health and health-related issues as well. So we have a couple of more minutes. Is there anything else that we need to tell our people?
Well,
probably lots else.
There's so much else to discuss. In terms of language assistance services, we are hiring, we are expanding. We are adding interpreters as our communities change around us. We want to make sure that we're staffed correctly to provide those services equally to all of the language groups. And so recently we have added a full-time position in Arabic, which has been a blessing to our organization as we bring more Arabic speakers to Revere Family Health and to our Malden care site. We're looking to add positions in Vietnamese and Mandarin. And we're always available as a resource to individuals who are interested in becoming medical interpreters. You can reach out to our department and we can give you some leads on how to get your start.
Well, that's important.
Yeah, we're interested in training the next generation of interpreters now.
There we go.
Proactively thinking about how our communities will change in the future.
So, all right, I think that's the end of our show today, but thank you so much. This has been such a learning experience for me, and I hope for everyone out there.
Thank you for having me. It's been a delight.
Thanks so much.